Hello and welcome. Those first few weeks with a new baby are just magical. But let's be honest, they can also be a little overwhelming. Today, we're going to cut through the noise and break down the absolute essentials of newborn health so you can feel confident and prepared. Let's dive right in. So, with all the information out there, what do you really need to have on your radar? Well, we're going to walk through some of the most common things you'll encounter, like jaundice, all the way to some rare emergencies, and of course, the basics of feeding. It's all about clear, simple info you can actually use. First up, we're talking about something a ton of parents see in those first few days: newborn jaundice. You know, when the baby looks a little yellow. It's super common, but understanding what's going on underneath the surface is really important. So, what is jaundice really? Well, in the simplest terms, it's that yellowish color you see. It happens because of a buildup of something called bilirubin. Think of it this way. A baby's body is breaking down old red blood cells, which creates bilirubin. But their brand new little liver isn't quite up to speed yet on clearing it all out. So, it builds up for a bit. Okay, now this is the part that really matters. Why do we even worry about it? It's because of this specific type of bilirubin, the unconjugated kind. The key thing to remember is that it's fat soluble. And because the brain is fatty, this type of bilirubin can actually cross into the brain tissue, which is exactly what we want to avoid. That's why we take it so seriously. So here's the deal. Not all jaundice is created equal, and the number one clue, it's all about timing. Look at this chart. If that yellow tint shows up after the first 24 hours of life, it's usually just physiologic, totally normal stuff. But, and you have to remember this, if you see yellowing within the first 24 hours, that is a red flag. It's considered pathologic, which means it's never normal, and it tells us something else is going on that needs immediate attention. And if a baby does need treatment, it often looks like this: phototherapy, those cool blue lights. It's pretty straightforward. You protect their little eyes, leave just a diaper on, and, this is my favorite way to remember it, you turn them every couple of hours, just like you're flipping a pancake. This makes sure all of their skin gets exposed to the light. And feeding is key to help flush all that bilirubin out of their system. Okay, so what could cause that more serious pathologic jaundice we just talked about? Well, one of the big culprits can be a blood type mismatch between the mom and the baby. Let's dig into what that actually means. This mismatch can cause something called hemolytic disease of the newborn. Now, that sounds like a mouthful, I know, but the idea is actually pretty simple. The mom's immune system makes these antibodies that see the baby's red blood cells as a threat. So those antibodies cross the placenta and start attacking and breaking down the baby's cells. And what happens when a lot of red blood cells break down at once? You guessed it, a huge surge of bilirubin. But here's the amazing news. For the most serious type of this condition, we have an incredibly effective prevention tool. It's a shot called RhoGAM. An Rh-negative mom gets it around 28 weeks pregnant and then again after the baby is born. It works by basically telling her immune system, hey, stand down, so it never even starts producing those dangerous antibodies. It's a real game changer. And just to clarify, there are two main types. The big one we really worry about is Rh incompatibility. That's the one RhoGAM prevents. The other is ABO incompatibility, which is usually way milder. You often see that when a mom with type O blood has a baby with type A or B. Okay, let's shift gears a bit. We're moving from conditions we can often see coming to some very rare but very critical delivery room emergencies where quick, correct actions are everything. The first one is called shoulder dystocia. This is a real emergency. It's when the baby's head has been delivered, but then their shoulder gets physically stuck behind the mom's pubic bone, and delivery just stops. The very first thing that happens is a move called the McRoberts maneuver. And it's as simple as it is powerful. You pull the mother's legs way back. The phrase to remember is knees to ears. This one simple action changes the angle of the pelvis just enough to help that shoulder pop free. It's amazing. And right along with that, this next part is absolutely critical. Someone on the team will apply what's called suprapubic pressure. That's direct pressure right above the pubic bone to help push the shoulder down and out. What you never do is fundal pressure, which is pushing on the top of the mom's belly. That is dangerous, it's incorrect, and it can cause serious harm. All right, let's talk about infections. A newborn's immune system is just getting started, so prevention is the name of the game. And what is the single most effective tool we have? It's not fancy or high-tech, it's good, old-fashioned, thorough hand washing. Simple, right?
We also give an antibiotic eye ointment to prevent eye infections, and we're always on the lookout for signs of a serious infection called sepsis, like a baby's temperature being all over the place. Now, for babies born with a neural tube defect, like spina bifida, their care is incredibly specialized. The absolute top priority is protecting the little sac on their back. We do that with a sterile, moist dressing. They can only be positioned on their tummy to keep any pressure off that spot. And everything has to be gentle. So gentle, in fact, that you would never, ever take a rectal temperature. Okay, let's bring it home with a topic that is front and center every single day for those first few weeks: feeding and growth. I mean, this is the foundation for everything, right? And you can just see from this list why breastfeeding is often called liquid gold. It is just incredible. The benefits are a two-way street. For the baby, we're talking a lower risk of infections, SIDS, and obesity. And for the mom, it helps reduce postpartum bleeding and even lowers her risk for certain cancers. It is truly amazing stuff. So what does a good feeding routine even look like in those early days? Well, it's all about frequency. We're aiming for at least 8 to 12 feedings in a 24-hour period. Yep, that means you'll definitely be waking up a sleepy baby to eat. And how do you know it's going well? You're looking for a good latch, you can actually hear them swallowing, and of course, the proof is in the diapers. Getting 6 to 8 wet diapers a day is a fantastic sign. And for families using formula, the rules are just as important. You start with really small amounts because their tummies are so tiny. Think just half an ounce to an ounce, and you feed every 3 to 4 hours. The big safety rule here: you never ever prop a bottle up and leave the baby to feed alone. It's a serious choking hazard, so they always need to be held. Okay, and I really need everyone to hear this one. This is probably the single most important safety rule for formula feeding. You must never change the ratio of formula powder to water. Don't ever water it down to try and save money or make it more concentrated thinking it's better for the baby. It's incredibly dangerous. It can mess up their electrolytes and seriously harm their kidneys. Always, always mix it exactly as directed. Wow, from the 24-hour rule for jaundice to the simple knees to ears trick, we have covered so much ground today. And, having this knowledge is the absolute best thing you can do to provide incredible care. So I'm curious, what was the one thing we talked about today that really made you go, I had no idea? Thanks so much for joining me.